After the age of 70, medical testing becomes a routine part of life for many people. Regular checkups, scans, and screenings are often seen as a responsible way to stay healthy and prevent disease early. But what very few people realize is that not every medical test provides clear benefit at this stage of life. In fact, large-scale medical research has shown that in older adults, a significant portion of routine testing can lead to unexpected consequences, such as unnecessary treatment, additional procedures, and increased stress without improving overall outcomes. Some studies estimate that nearly 1 out of every 3 medical findings in older patients may never actually cause harm during their lifetime, yet still leads to intervention. This raises an important question. Are all routine medical tests truly helping seniors, or can some of them unintentionally create more complications than solutions? In this video, we will look at 5 commonly recommended medical tests for people over 70 that deserve a more careful evaluation based on modern research and clinical understanding. And stay until the end, because the final test is one that even many healthcare professionals continue to debate today. Before we continue, let us know in the comments your age and where you are watching from. It is important to understand one key idea. As the body ages, medical decisions become less about detection alone and more about balancing benefit versus risk. A test that may be helpful at age 50 does not always provide the same value at age 75 or 80. This is why modern geriatric medicine increasingly focuses on personalized care rather than routine one-size-fits-all screening. Number 5. Bone density scans, DEXA. One of the most common tests recommended for older adults is the bone density scan. It is often presented as a simple way to prevent fractures and monitor bone health. A DEXA scan measures bone mineral density and is used to identify conditions like osteoporosis. However, in older adults, especially those over 70, mild reductions in bone density are extremely common and often part of natural aging rather than disease. The concern begins when small changes in bone density lead to medical labeling and treatment that may not always be necessary. Some medications prescribed after these results can carry side effects, such as digestive discomfort, joint pain, and in rare cases more serious complications affecting bone health.
Research from geriatric studies has shown that in low-risk older adults, the reduction in fracture risk from medication can be relatively small, while the likelihood of side effects may be higher. This does not mean bone scans are harmful, but it highlights the importance of interpreting results carefully rather than reacting automatically to numbers alone. Have you ever had a bone density scan done? Let us know your experience. Number 4. Brain MRI for mild memory changes. Memory changes are one of the most common concerns in older age. Naturally, many people turn to brain imaging for answers. Brain MRI scans can detect structural changes, but in older adults, many of these findings are not linked to serious disease. Age-related changes in the brain are extremely common and often do not correlate directly with cognitive decline. The challenge is that once these findings are seen, they can create unnecessary worry and lead to further testing that may not provide additional clarity. Clinical studies show that only a small percentage of MRI findings in mild memory concerns actually lead to treatable conditions. In many cases, basic cognitive testing and lifestyle evaluation provide more practical information than imaging alone. Have you or someone you know ever had a brain scan for memory concerns? Number 3. Cardiac stress testing without symptoms. Heart health screening is extremely important, but not all tests are equally useful in every situation. Cardiac stress tests evaluate how the heart performs under physical strain. However, in older adults without clear symptoms, these tests can sometimes produce misleading results. False positives are more common with age, which can lead to additional invasive procedures such as angiography or stent placement. In some cases, these interventions may not improve long-term outcomes, but can introduce additional risks like complications from procedures or extended recovery time. This is why symptom-based evaluation is often more important than routine stress testing in low-risk individuals. Do you think heart tests should be routine after a certain age? Share your thoughts. Number 2. Routine colonoscopy after 75. Colon cancer screening has saved many lives, but timing plays a crucial role. Colonoscopy is effective in detecting early abnormalities, but after age 75, the balance between benefit and risk begins to shift. The preparation process can be physically demanding and may lead to dehydration or electrolyte imbalance in some older adults.
Sedation and procedural risks also increase with age, especially in individuals with other health conditions. Large population studies suggest that while some benefit still exists, the number of complications rises significantly in this age group. Because of this, many modern guidelines recommend individualized screening decisions rather than routine continuation. Have you ever had a colonoscopy after 70? Let us know. Number 1. Full-body CT scans. One of the fastest-growing trends in preventive medicine is full-body scanning. Full-body CT scans are marketed as a way to detect disease early, but they also expose the body to radiation and often identify harmless findings. These incidental findings can lead to further testing, biopsies, and sometimes unnecessary treatment. Medical research shows that there is currently no strong evidence that routine full-body scans improve survival in healthy, symptom-free individuals. This is why many medical organizations recommend targeted imaging only when there is a specific clinical reason. Do you think preventive scans are helpful or unnecessary? Comment below. Modern medicine has made incredible progress in early detection and treatment. However, more testing does not always mean better health outcomes. Especially in older age, the most important approach is not just finding abnormalities, but understanding whether those findings truly impact quality of life. Health is not only about detection, but also about balance, independence, and informed decision-making. The goal is not to avoid medical care, but to use it wisely. Tell us in the comments, have you ever experienced a situation where a medical test led to more stress than benefit? Your experience could help someone else make better decisions. There's a lot more important information like this coming soon. Don't miss the next one. Thanks for watching.